Hello everyone, I'm Neto Rosatelli and it is a pleasure to be here with you exchanging knowledge and experience. Recording surgeries is a most challenging task for many reasons. Aspects regarding equipment and technical knowledge can be daunting, as most microscopes do not come or have a complete video recording system. Equipment cost can be an important issue. The surgeon is burdened with the additional task of the recording demands on top of the surgery itself, as well as all the video editing and data managing. Adequate preparation is necessary. There are many reasons to record your surgeries, and I list only a few more common here. Recording requirements or characteristics may vary according to the purpose, of course. A beautiful video demands a beautiful surgery. Okay, I'll comment here on 8 key points of attention when recording cataract surgeries. Proper focusing is undoubtedly the most important factor in video quality. It surely is an obvious thing, but the fact is that the surgeon often is too distracted with the surgery itself and does not perceive loss of focus or does not attempt to correct it. It is fundamental to maintain focusing at all times and be used to ensure that. Sometimes it is difficult to find the focusing plane of the microscope, and the easiest places to focus are the limbal vessels or the iris, with small details and good contrast. It is useful to get used to the offset between the planes of the cornea, anterior and posterior capsules to be able to quickly and accurately change focus during surgery. It is most important that the surgeon and the camera have the same focal point. This can be very difficult to assess and even more to correct, as most microscope camera adapters don't have focusing capabilities, demanding adapter modifications. Ideally, the oculars should be zeroed to ensure parfocality at all magnifications, else focus will be lost every time you change the zoom. If the adapter has a diaphragm or if your camera allows, closing the diaphragm a few steps extends depth of focus. I consider that centering the eye is the second most important quality factor. The anterior segment should always be completely in the frame. This can be very challenging in uncooperative patients, though. Sometimes the eye ends up drifting, and here I have an editing tip. Always recenter before or right after exiting the eye or finishing a surgical step, and recenter right before starting steps. It is common to have idle time between surgical steps, and when editing out segments, this makes for smoother transitions, avoiding annoying image jumping. Adequate magnification comes next in our list. Surgeons like to see details, and too little magnification hinders it. A limbus-to-limbus framing usually is the maximum that is practical or doable during surgery, but enhances focusing and centering difficulties. Inadequate camera sensor size can create problems due to different magnification ratios between the oculars and camera. In dealing with these 3 requirements, it is necessary that the surgeon achieves absolute dexterity using the microscope control pedal. Constant practice leads to instinctively maintaining things proper, and it becomes second nature. Anterior chamber visualization is key. A wet and clean cornea is necessary, and I employ two techniques to ensure that. The eye wash. I have a dedicated video demonstrating that in one of my channels, which consists in washing the eye directly with the phaco irrigating line to quickly and effectively wet the cornea and wash debris. Covering the cornea with dispersive OVD enhances visualization and maintains a hydrated cornea throughout the surgery. Coaxial illumination was one of the most important improvements on the ophthalmic operating microscope. An adequate red reflex is of paramount importance to an easier and safer surgery and for recording requirements also. The surgeon must know how to properly adjust the microscope illumination settings to obtain the best image during surgery. Keeping everything ready and at hand optimizes surgery flow and greatly reduces idle time, facilitating subsequent recording editing. Please keep cannulated instruments primed. Bubbles are one of the most annoying and unsightly things when watching surgery videos. Performing smooth, deliberate, and explicit movements is the right way to operate. It not only conveys a sense of skill and knowledge, but is also the best way to demonstrate surgical techniques. Don't let your hand get in the way. No hurry. Avoid shaking the eye during maneuvers. It is not only ineffective, but also dangerous and looks as bad technique. If it is adequate, editing out idle segments can shorten the video by eliminating unnecessary footage. Be careful not to skip important steps. Surgeons want to see details of the technique employed. Be careful when fast-forwarding segments. You are showing what was done, but not how. Recording surgeries almost always end up having a very positive effect on the surgeon's technique in a kind of Hawthorne effect. The surgeon increases the quality of the surgery that is being recorded and ends up incorporating improvements on his technique elicited by that. I hope this presentation helps you in making better surgery videos. Thank you for your attention.